I want to talk about how to put the patient above everything, and the challenges that one can have with very complex patients, and to keep focused, to do the best that you can for them, not only related to the procedure that you can do for them. MS, who's 36 years old, was referred to me by social services. She'd previously been informed that she has to have all her teeth taken out. The purpose of what I want to talk about is more philosophical. How do we help this patient? She came in very angry, very unhappy, very clinically depressed. The diagnosis was aggressive periodontitis, very white teeth, not a very dirty looking mouth. Even the gingiva the color was fairly good, except there was the usual purple color where you see there's bone loss. Now comes the challenge. What am I going to do to help this patient where I have to put together a team? We have to put a team together of dentists. Is it going to be an orthodontist, a general dentist, endodontist? The next challenge was the staff. Very often the patients coming into my office have had failed treatment, have had treatment that's cost a lot of money, it's taken a lot of time, and they haven't been satisfied, and they're angry. The question of money, they've already paid out a lot of money, and now we have to be a magician to do the work inexpensively and do it right and in the least amount of time. If the patient doesn't undertake or have a commitment to maintenance, there's no point in putting the patient through orthodontics, periodontics, restorative work, because within a year or 2 or 5, it's all going to fail and the energy was wasted. I had in this particular case more than one prosthetic dentist. The one prosthetic dentist got tired of the case. He got tired of her not coming in on time. The orthodontic treatment, Dr. Yooel Blustein, who you've already seen some of his cases with Dr. Aner, does very nice work with adults. 2 dentists had had enough already, and now she was back on my doorstep to do the restorative work, and I don't do restorative work. However, just at that time, I got an advert from Chakir Dental in my mail. It was fortuitous. And the advert said, if you have a patient who's a Holocaust survivor or is from social services, we'll come into your office, we'll scan the mouth and give you a free zirconia crown. Good advert. Well, I immediately took that up. Not doing restorative dentistry, I used to only work with impressions when I did restorative dentistry. So I took up the opportunity and I did a crown for her, or an onlay. You can see that there's angular bone defects, there's horizontal bone defects, there's a cantilever bridge resulting in secondary caries, spacing between the teeth, and all the findings that I mentioned earlier. These are the x-rays in 2017 where everything has been stabilized. The carious tooth, the 2.8, has been removed. She's had a new bridge made from 2.5 to 2.7. The last challenge I was faced with was I became her dental father. And I think we're all faced with this challenge sometimes. Anything dentally oriented, she presented on my doorstep, until I had to get to the point where I said to her, listen, I undertook to treat you as a periodontist. I've done all the work I can. I gave her 2 years of free maintenance therapy in my office. She continues to come to my office at a very low price for maintenance. I think it's important that she pays something, because if she doesn't pay something for maintenance, I think there's a lack of value in it, and she has to feel part of it. And she's really, if you look at the next slide, you'll see her face tells it all. She's got a beautiful smile, she's a very happy patient, and she's willing to cooperate with anything. Her whole personality changed, her whole demeanor changed, and she's much happier now. So I'd like to thank, first of all, the patient for cooperating with me. I'd like to thank social workers, Dr. Solie Bergman, who was one of the restorative dentists, and another dentist. And Dr. Yul Blustein, unfortunately for the restorative maintenance, I still haven't closed that gap yet, but the patient knows that it's not me. Thank you for your attention, and hope you enjoy the rest of the Congress.
על האומץ להראות משהו אחר.
תודה רבה. תודה.